Hey everyone, this is Reggie and welcome to my channel. In today's video, I want to discuss a common condition that a lot of people experience. It's herniated disc symptoms in the neck. If you have experienced neck pain before, then this video is for you. But before we begin, make sure you hit that subscribe button and turn on your notification so you won't miss out on our other videos to help you get pain-free. Let's jump right into it. Now first, let's clarify, what is a herniated disc? So the herniated disc is when the soft gel-like middle core comes out of the tough outer layer of the spinal disc. Now, you'll see that image here, and when that happens, it will affect the nerves around the area. So now, let's see how that affects you in particular. Now, the first symptom is pain. Pain can range from being mild to severe. It depends on the extent of the herniation and also the location. Now, it can be localized in the neck area, or it can even be traveling down your arm as far as even your fingertips. Depends on what nerve is affected and where that nerve ends. If that nerve ends in your, let's say, the middle finger, the tip, then you're gonna feel the pain in the tip of your middle finger, or you can feel the pain all throughout from your neck to that middle finger. Aside from pain, you can also have tingling or numbness because it depends on what nerves are affected by the herniation, because some nerves carry pain impulses. Then when it's affected, then you feel the pain. But some nerves carry sensation to your brain. Now, when these nerves are affected, you will have altered sensation, and that's when you have tingling or numbness. And you may feel these tingling or numbness on your shoulder, the arm, or even in your hands. Another symptom that you may feel or experience is weakness, because not all your nerves are sensory nerves. Some of your nerves are motor nerves, and if these nerves are affected by the herniation, you will develop weakness because the nerve impulses will not be enough to get your muscles to contract. You can also have symptoms like weakness of your hands. You won't be able to grip as well, or you're going to have difficulty with fine finger movements. You're not going to be able to grasp small objects properly. If you suspect that you may have a herniated disc, please make sure you consult a specialist. Sometimes imaging like MRI or at least an X-ray may be necessary. And also, if the symptoms are worse enough, you may need to have physical therapy, pain management, or worst case scenario, surgical intervention. So let's make sure that you get that properly diagnosed so that you know what the proper treatment will be. Prevention is key. So for your neck, make sure you have a proper exercise regimen, maintain a healthy lifestyle. Proper posture is very, very important, and avoid activities that are straining your neck. And if you have a desk job, make sure that your desk or your workstation is ergonomically designed. I have some videos and show you some basic ergonomics that you can follow so you can properly design your workstation. Understanding the symptoms of a herniated disc is the first step to an effective management. If you like this video, please give it a thumbs up. It helps a lot. And thank you very much for watching this video. I'll see you in the next one.